Hi, my name is Minna Hokka and I'm coming from Finland, and I'm a nurse with a clinical expert master degree and also a master degree in nursing education and a PhD candidate. I'm working as a senior lecturer in the University of Kajaani, and I'm teaching nursing students in bachelor degree. And I'm going to speak to you about some national and regional approaches we have here in Finland about digitalization and gaming. And I will begin with the national approaches. It's recognized in Finland that palliative care services is not integrated fully in our healthcare system. And also the education varies quite a lot between different universities who are educating our physicians, and also in the universities of applied sciences who are educating our nurses. And we don't have systematic postgraduate education in palliative care yet. But we have quite a big approach with 1 million euros from Ministry of Health. We are trying to build the recommendation to integrate the palliative care in our healthcare system. And in this project, we are also included recommendations to ensure the competencies for nurses and physicians in palliative care. And then we have a big national project which is funded by the Ministry of Education and Culture. And there we are developing our education system so that palliative care would be one systematic subject in both the physicians and nurses education. And here you see it as a picture, and maybe I'm here to speaking to you because in the project of our Ministry of Health, I'm one of the experts building the recommendations, and I'm the lead in that work group where we are building the recommendations to ensure physicians and nurses competencies and education of palliative care. And in the EduPal project, where we are developing our degree education for physicians and nurses, it includes all of our 5 medical schools and also 15 universities of applied sciences who are educating our nurses. So I'm the head of this project, and in this project we are also developing innovative ways to provide palliative care education. And about gaming, when we are speaking about gaming and when we are speaking about education, we are usually speaking about serious games or applied games. It means that we are using gaming technologies in other purpose than just entertainment. All of us, I think, already knows games where the main purpose is entertainment. But when we are using gaming in education, we are using the same methods, but the purpose is educational. There are already games to educate and to train several subgroups. We are usually speaking about edutainment or advert gaming or training, and we have also simulation games already existing. And when we are speaking about the methodology of gaming, when we are speaking about gaming, it means that we are building a structured conflict to the students or the players, and we are also building the process what allows the player to, in an entertained way to resolve the conflict we have built in the game. And we can really use gaming as a motivator, and we can use gaming to change behaviors. There are already existing data on these issues, and gaming allows us to create situations where the student really can live the story, not just read the story or hear the story from the teacher, but we also can provide the possibility to live the story. And there are already publications about gaming in nursing and medical education. One systematic review have told that serious games really have potential to improve healthcare professionals, which included both nurses and physicians. It can improve the knowledge, it can improve the skills, and also the adherence of resuscitation algorithms. And also there are discussion papers where physician experts tells that serious games would be a way to improve internal medicine curricula. And actually, we have also some research done in the context of palliative care of this issue. There are made an prospective randomized design research about using computer-based program to teach physician students about advanced care planning. And the results was that it was significantly better in medical education than standard education when we were using this. And also about the nursing context, when they were teaching palliative care, they were using games in the classroom, and there were an increase in the students' value of palliative care as a subject, and also an increase of the encourage to discuss about death with the families, and it decreased the fear of talking about death. So something is already, so that we can say that we already have some data about this, but not much, and it's quite weak. But what have we done and tested in our University of Applied Sciences? Together with our gaming department, we have developed different kind of serious games. For example, we have an aging game where the students have the possibility to experience how it is to be an elderly people, how it is when you can not lift something from the floor because your hand is shaking, or how is it to listen to the radio if you don't hear very well or don't see very well, if it's difficult to walk, and so on. So it's like an exposure game to give the experience to how it is to get older and be have some restrictions of hearing or seeing or something like that. Then we have the game of my life, which is built for youth people. And it gives the possibility to learn how to communicate with young people with problems with their own life. And then we also have built an VR problem room. And if we have time, I will show some elements of this game. And also we know, as already you also know, that the healthcare staff needs knowledge and skills to integrate digitalization into clinical practice, and to build some bridges to this competence. We have also built a DIGIOS learning environment. In this learning environment, we have the possibility to teach our nursing students how it is to provide e-health. And this learning environment we can also use if we want to used like escape room methodology to learn the nurses to provide e-health. And now going to the escape room, we can also use escape room methodology in education. It means that we have a live action team which includes nursing students or other students, and the players have clues, or they are solving puzzles or some accomplished tasks to get further in their education and in the escape room game. And escape room, I think some of you maybe have been in the escape room because there are built like places where you can go with your team and try to escape from the room, getting some clues or something like that. But this can also be used in education. Then we are usually speaking about educational escape room methods. And usually the common learning outcomes with this kind of methodology is teamwork and communication, but you can learn the students different kind of subjects as pain management or something like that when you are building your clues, that they have to have the competence of the pain management that they can solve the clue. And I have an example of our virtual escape room, and now I just try to show it for you. I hope this will work. Do you see it now?
Yes, now we see.
Okay. Oh. So do you see the PowerPoint again?
Yes, we see
Oh, that's
PowerPoint.
okay. So now you saw a little introduction video about virtual game, and the idea is that we have built their home environment and hospital environment and different kind of situations for the students to solve, and we can use it to further development because we had the environment now. And we have one project, Mystery 24/7, and we are developing this virtual escape room further in that project. And when we are speaking about gaming, I think I want to say to you that you don't always need expensive technologies to use gaming in education. One of our very, very smart teacher, Taina Rompanen, has been using escape room ideas in nursing education for a while already without any technologies. Here you see the puzzles the students have to solve, and they don't get further without solving the puzzles. So the idea with this picture is just to tell you that we don't always need technology to use gamification. And what is our plan for the future? We have an funding for an Erasmus project, nurseEduPal.euro, and the aim is to develop innovative learning methods. And here we have Hovest University, Kajani University of Applied Sciences, and also University of Brasov and European Association for Palliative Care. And we are aiming to develop an innovative, cost-effective and user-friendly teaching method to teach palliative care by using escape room methods. And this will be translated to Romanian also. And for a conclusion, I would say that based on evidence, we can say that serious gaming may increase learning outcomes. But based off our own experience in our own university, I would say that there is a place for gaming in nursing and medical education. Our students are already quite used to use technology, and we really could use gaming in education. And the next speaker, Verle, will also speak about one of the innovative methods we are going to develop in our nurseEduPal.euro. So you will hear a little bit more about what we are planning to do. And I want to thank you for listening me, and I hope that I could give some new ideas for you and speak a little bit about the work we are doing here in Finland and what we are doing together with our international colleagues. And thank you. And here you see my little dog and my horse. So thank you.
Thank you very much, Minna. It was a very interesting presentation.